I'm going to take the next couple of minutes to discuss something not related to the drug. I think something I want to take advantage of having you on to ask you a few questions. You've been championing the cause of women cardiovascular health and advancing women in medicine. You're co-founder of nonprofit organization like Women as One. Can you tell us what's happening nowadays? Are we seeing more involvement in our not only physicians who are women, but also getting patients in studies that to truly represent the female population? Can you tell us more about what's happening in that world?
Well, so first of all, thank you for that question. I think this is an important question and an important topic to cover. And a few years ago, about 6 years ago, I decided to kind of really think about all of the great opportunities that I had. And it was all by play of chance for ending up in a fantastic group of mentors and supporters. And I was uplifted, I was given opportunities. And yes, I worked hard, but I really did have the opportunities. And I felt that it was important that there must be many, many amazing women out there who are never given opportunities, who are never recognized, who are never asked to be given the chance to shine. And I felt that we needed an organization that did nothing but to find these women and to connect them with the opportunities. And we were able to do that with this small but extremely powerful, nimble organization, Women as One. It's an organization that does nothing but promote women, talented women, to opportunities that would otherwise not be offered to them. And how we do that is by understanding who they are, seeing what's out there, and making those connections for these women. And the organization has gone, I would say, from zero to hero in terms of changing the landscape of many, many more women coming into cardiology and interventional cardiology, perhaps because we really focus on the most broken house, which was interventional cardiology. But I believe that we've only hit the tip of the iceberg. There is so much more under that very, very smooth water, that the tip of that iceberg is what you're seeing. There are a lot more difficulties in women in leadership positions. They're still not meeting the leadership positions they deserve to be at. They're still not being elevated, even with hard work. And about 5 or 6 years after they come into interventional cardiology practice, a lot of women are leaving the practice because it is really daunting and toxic and not really a great place for growth and development. And let's face it, our subspecialty is not a family-friendly subspecialty. There, we're frowned upon if we want to spend time with our family. We're expected to be available in the middle of the night to answer emails about whatever our bosses want. And, it's not easy. And then, of course, our patients are still not perceiving women powerful enough to be able to go in and actually do a major procedure on their hearts. I mean, how many times do I go into a room with a medical student and he's offered to be the doctor and I'm supposed to be sort of the janitor in the room or whatever? And it's totally fine, but maybe it's not. And we need to make some changes. And why we need this? Because let me tell you, the workforce is suffering. All of us and our male colleagues want time with family. Our male colleagues whose parents were doctors are saying, I don't want to do the same thing to my kids. I want to see my kids. I want to go to the soccer game. I want to be there at the parent teacher conference. And and we're now in a whole different generation of more accepting, hopefully socially accepting things. But unfortunately, we still have some of the old timers around who judge us because we want to be with our families. And that needs to end. We as physicians have to come together and find a way forward for a more family oriented and a better environment so we could really enjoy the art that we have learned, the skill that we have in saving lives. And how rewarding is it? How amazing is it? And how terrible it is that many are leaving the profession because they feel under recognized, underappreciated, unheard, unseen, and that it continues to happen. So we continue to ignore those things and continue to work hard in making sure that women, first and foremost, shine for their merit, not because they're women, because they have the merit. If they made it as an interventional cardiologist, believe me, they're merited to be there at the same level of every man on that panel. And we're always ready to accept mediocre men, but we're always expecting women to be par excellence. So an average woman would never be good, but an average man is very well accepted. And we need to change those venues, those conversations, and rewire our brains away from the implicit bias of the way we used to think to new highways of thinking about the fact that we absolutely are hurting the humankind by treating our women, the underrepresented minorities who are physicians, our Black physicians, our Hispanic physicians, the women, with a different lens than our white male colleagues. And it's not about anything except to let's come together and work together and make sure that we could really promote all of us to what we all deserve for all of the years of study, years of sacrifice, and where we are now in being available for our patients and transforming their lives by being there for them, by learning new techniques, by having cutting edge technologies be practiced in our practice suites with the way we are helping humankind. That is how we will change human health and transform it. All of us together. And it isn't about a not-for-profit organization that's thinking about women. It was just literally the first step to what we need to go, where we need to go, because all of this nonsense has to end because we absolutely have a shortage in our workforce. Cardiovascular disease is not decreasing in its incidence as it used to. That rate of decline has slowed down. And we absolutely need to kind of rethink the way we are imagining how the workforce is going to be dealing with this. And now our hospitals have become business units and treat us as their pawns. And those are the kinds of things that I'm extremely concerned about as the incoming president of the American College of Cardiology. And I'm paying a lot of attention to this. And as the workforce, whoever you are, cannot be poorly treated because we will lose our best in class next generation of the cardiologist who's going to save lives and transform cardiovascular care.
First of all, congratulations. That was my next question, but I want to say how important the work you and other pioneer interventional cardiologists, female interventional cardiologists. I personally was trained under I call her one of the best interventional cardiologists, period, Dr. Dawn Abbott at Brown. And she taught me a lot. And I think many of our colleagues, females, minority, or even sometimes just people who think that they're alone. And I think with the work you're doing and others doing to empower cardiologists, empower interventional cardiologists, empower female cardiologists to speak up, to take a leading role is extremely important. So really thank you for all the work you've been doing and congratulations on your position, upcoming position